in studies has been shown to be anti-proliferative. So it doesn't promote growth of breast cancer cells, and it induces apoptosis or death of breast cancers. What protocol is good for stage 3B cancer patient with a bleeding lesion? Not on the nipple, but on the skin above the nipple. Okay. Ano ba yung mga signs and symptoms of breast cancer? Usually, they have a lump in the breast. That's the majority. And if you look at the skin, meron po tayong tinatawag na peau de orang. Okay. So, pag nakita nyo yung breast, para siyang peelings ng orange, diba? So, meron siya para mga pitting, okay, pain, and usually they have lymph nodes, and occasionally nagkakaroon po ng weeping wound. So nagkakaroon tayo ng wound that doesn't heal. So ang tagal-tagal na hindi pa gumagaling. Tapos pain, ayan, yan yung mga most common symptoms of breast cancer. Again, if you talk about cancer, you have, especially for breast cancer, ovarian cancer, you have to change your diet, okay? Kailangan unang-una, do not be eating foods that are rich in sugar. And it's better for you to research on xenoestrogen, GMO, endocrine disruptors. Because these are the more common causes of cancer right now. So, marami yan, mga plastic, yung mga kinakain po natin, usually mga nilalagay natin sa katawan, mga shampoo, ayan, yung mga SLS na tinatawag natin, sodium lauryl sulfate, they're not very good for us. So, again, I told you about guyabano leaves, okay? Dapat mainstay na yan. And hindi po totoo yung chismis, because they're saying
Please address that.
Yeah, they're saying that guyabano can cause anemia, Now, this is my take on that, especially when everyone is demonizing guyabano leaves. I have used guyabano leaves for 15 years already. And some of my patients, they have been taking it for years. Ang tagal-tagal na. And some of them, they don't have anemia. They did not develop anemia as a result of guyabano leaves. But some, they develop anemia. But it's not because of the guyabano leaves. It's because of their cancer. Kasi ang cancer, one of the symptoms is chronic anemia. Okay, pag may cancer ka, usually may chronic anemia ka din. Okay, so meron ka ding chronic blood loss. So lalo na kapag meron kang problem sa colon, so minsan tumatay ka ng dugo, then you would have chronic blood loss and you would have anemia, but not really with guyabano. So Norge Lisa said, Doktora, ano po bang mabuting inumin ng may breast cyst? Thank you po. Okay, so there was a research about breast cyst, not only breast cyst but ovarian cyst, polycystic kidney disease, and it has been linked to a deficiency in iodine. Okay, so if you have any cyst in any of your body, the best thing to do is to eat foods that are rich in iodine. So what are these foods that are rich in iodine, honey?
Well, a lot of people would say, well, I'll just get more iodized salt.
Okay.
But kelp,
okay.
Kelp is one.
Kelp, nori, mostly these are seaweeds and seafoods, okay? So, but the problem with iodized salt is that it evaporates, okay? So when you open it up, you use it evaporates immediately. 50% is actually gone after that. So it's always better to use seaweeds, okay? Seaweeds always, okay?
Watching from
So, and
home.
all cysts, so these are because of iodine deficiency. So if you want to improve your health, if you want to remove all of the cysts there, the best thing for you to do is to eat foods that are rich in iodine. And excessive coffee drinking decreases your iodine stores inside the body. Again, excessive intake of coffee decreases your iodine stores inside the body. Okay, so for you to know that. So the iodine, okay, there are research that says that it decreases the cyst formation in the breast, in the ovary,
Okay, so it's very important for us to eat a lot of iodine like in seafoods. But the problem is for us to get the 150 microgram. Ang konti lang no, it's very tiny, 150 microgram. We have to eat so much seaweeds. Sabi nga nila, it's around, if I'm not mistaken, it's around 4 pounds to 5 pounds, okay, of iodine. And it's very important for cancers of the breast, okay, cancers of the ovary. So kung meron ka niyan, iodine is one of the best mineral that you can take. So kung meron ka man tanong,
And I just have a question, Dr. Farrah. So, with regards to adding all the stuff that I'm taking, what else can you recommend?
Again, like what I told you yesterday, in 2017, there was a study that came out about carica papaya. And carica papaya in studies has been shown to be anti-proliferative. So it doesn't promote growth of breast cancer cells, and it induces apoptosis or death of breast cancer. So you can take it, you can take the leaves, okay?
The
You
dried
just,
leaves as well?
it's better to always use fresh. Okay,
Okay.
you
The
squeeze
total
them, you make them as a juice, and then you drink them.
Oh,
Now,
juice it.
vitamins, yes. Now, vitamin C is a very important vitamin, and most people they have used it for several purposes. And Linus Pauling was the first one who used it for cancer purposes, and he used it up until some there were there because I have his book, and it was in that book it says he was giving it 100 grams per day. Yeah, so but again, if you're gonna do this, it has to be under a supervision of a doctor. Okay.